our Facebook page, and talk with Keeli Sholtey. She is in the studio with us. Keeli, we appreciate you coming back. You've been a regular guest here in the studio over the years here on Mom FM and Hot Country Hits, and we appreciate your dedication to those here in our community through West Michigan CMH. So thanks for being here.
Yeah, thank you. Thanks for having me. I think my first experience was during COVID 2020, so
I know.
we've come a long way.
Hey, we certainly have. In April, we've got April showers outside right now, and it is Autism Awareness Month, and so we want to dive into that. But also, we don't want to cut it short on that either, because it is Child Abuse Prevention Month as well. That we want to talk about, and especially coming up tomorrow, where I would assume, just like your lanyard, you're going to be wearing blue tomorrow, and many of us will to help with this, right?
Yep. So that's a national movement, but locally you might see some pinwheel displays that is put on, actually not through our agency, but the Children's Trust of Michigan, which is an agency we collaborate with. They will have different pinwheel displays throughout the community. You'll see, and it's just to bring awareness to child abuse prevention and recommit our efforts to prevention and treatment. And
it's a reminder that with anything that is something that's different that we're maybe driving down the road or see in the public forum, it's just a reminder that helps us keep that awareness up. Let's dive into children's services with West Michigan CMH, especially when it comes to April being Autism Awareness Month. There is a lot of steps that West Michigan CMH focuses on to be able to handle, and I say that, and tell me if I need to be corrected on this, the different spectrums that are out there with autism. Let's dive into that and what services are available.
Yeah, so one of our many children's services is ABA, which is Applied Behavior Analysis, which is the standard treatment for autism spectrum disorder. That doesn't mean anybody with autism spectrum disorder needs ABA. Okay. It can benefit, but we have a severity rating that we do with testing and assessment that we determine need. And through that, oftentimes it's the higher spectrum, or the lower end of the spectrum of less functioning that we would treat.
Okay.
So we can help people learn communication skills, social skills, maybe developmental skills. Research shows that early intervention is most effective. So we try to hit people at the ages of 18 months, year, 2 year, real young, and just when they're developing. So
is there, I think people in the back of their mind, at least for me, I always wonder if if a child is diagnosed with autism, is there actual, and maybe there is, I just don't know, is there actual, you reach them at a younger age, and you can see that the development has changed and has improved? Is there actual, I don't want to say evidence, because that's just kind of too broad, but do you see that there is improvement, and how different of improvement can somebody that is diagnosed with autism, and I understand there's many diagnoses there, but can we improve their health, and you see it and clearly see it?
Yeah, so the goal is quality of life improvement for any services we provide at our agency. But yes, so research shows, and I think that was the evidence research, that this behavior therapy can improve quality of life. Okay. So do we look for a fix? Not necessarily, but we look for how, an example would be if we struggle to communicate our needs, we want to figure out a way that a child can communicate that effectively and not have behaviors that negatively affect their life. So they might have a behavior that happens maybe in a classroom or in school that's really, really hard to manage because they're having trouble communicating what they actually need. And so our goal is to help them learn how to communicate that and then not have those behaviors.
Okay, and that makes sense. Because, again, somebody from the outside looking in, we see somebody with autism, and especially as a child or a teenager, and say, okay, maybe they'll have improved, if you want to use that word, into their 20s or 30s. But sometimes we have to come to a reality, again, outsiders looking in, is that though that doesn't necessarily improve it. That is the way they will be for life in some cases, right?
Yep, and that's part of autism awareness, is accepting and just embracing differences, because people are different, and that's okay. And that's how people function. It's just, how do people have the best quality of life?
There you go. Absolutely. Yep. Do you mind? I want to go a step further with this, and there was a reason why I brought that up is, when it comes to parents, I mean, when their child is diagnosed with autism, you're having that conversation with the parents. Yep. Do you mind kind of giving us a sneak peek of what that is like and what those conversations are like?
Yeah, so our BCBAs, or Board Certified Behavior Analysis, those are the individuals who do the behavior assessment and determine the treatment plan for that specific youth.
Okay.
And then from there, part of that treatment plan includes parent training. So a BCBA is going to work with that parent, and how do they, in their environment, help this child be successful. And part of that is education, just learning different techniques, learning different ways to interact. So it's really a whole team, whole family approach. It's not just, we take your kid to treatment and then they come back. It's we want to engage everyone, and that's really successful too. The research shows that the parent training and the ABA together is the most successful.
All right. And that brings us to the next question. You can do things at home. The schools are involved in many cases. There's a lot of connections there. And then obviously the services at West Michigan CMH. What is that like? Break that down between the various options that people have.
Yeah, so outside of our ABA treatment, we have case management services, we have home-based services, we have wraparound facilitation, which is essentially involving every individual agency that's part of a youth's case, and really doing like team meetings, having a strength-based treatment plan. And so that's a really intensive service. We also have therapy. We have community living support services. We have youth peer support. So a youth peer is someone who has lived experience with mental health, and they help come alongside someone and help them empower themselves and really just take control of their life. So yeah, we have all those array of services, and it does include coordination with a ton of community members. So as we know, youth are involved, especially in school. There might be like DHS involvement. There could be, we have Staircase Youth Services locally. Trying to think of other ones. The Children's Advocacy Center is another local agency that we coordinate with, juvenile court. But we do try to get together very often and have those team meetings to really just provide the best wraparound care for everybody.
If you're just joining us, we're talking with Keeli Sholtey, Director of Children and Family Services here at West Michigan CMH. A couple more questions. And again, I want to try to take this segment from the outside and the inside. The inside of that, the interaction, from being diagnosed with autism to the services that are provided, and we've talked a little bit about that. But let's step back just for a moment again as we ping pong this topic and talk about the community members in general, people that are out and about. How do we? And it's not like we're walking around to identify people with autism, but how do we recognize different characteristics of autism? Because it can be light, it can be extreme, right? And so what do we see when we're out and about?
Yeah, so as you know, as you've described, it's a spectrum disorder. So there's high functioning, lower functioning spectrum of the diagnoses. But really for youth especially, most of the time we get referrals from schools, pediatricians, other people in their life who are qualified to really assess that. But if a parent has a concern, absolutely walk in, be screened. I mean, there could be a million other things going on too. It's not always just autism spectrum disorder. So we try to tease that out. But yeah, definitely use your resources. The ESD has early on services, which anybody can be referred to, and they help make referrals to us as well. So yeah, it's really just using your resources and talking to people about it that you already maybe see or that are already involved in your life, and then also walking in to have an assessment or screening with us. You
broke down and mentioned some of these, the ESD, Staircase Youth Services, Michigan Department of Health and Human Services, the Children's Advocacy Center. Obviously there's a lot of agencies there. For somebody that is a parent that might not know if their son or daughter has autism, where are we? Obviously, we want them to go to West Michigan CMH as well, but is there a starting point for all of this? Because it can be very confusing from a parent standpoint, right?
Sure. There is also autismspeaks.org has a ton of information. So that's a national website that you could just review if you want to gather more information. I mean, that's a reputable source. But yes, I would say just speak to the people that are really involved in your life that are professionals. We don't ever want to diagnose somebody without doing screening and assessment and using evidence-based tools. So we try to really just not put those diagnoses on people until we have confirmation through evidence-based tools.
All right. What about education? So we talk about the educators that are out there. Obviously we have students that are in class that have autism. How do they manage to balance that out? What's that interaction that you've had or your team has had with educators in general?
Yeah. So from our perspective, if we have somebody in our services that's receiving ABA, we're part of that IEP or that treatment plan through the ESD, and we do a lot of linking, coordinating. But I mean that there could be someone with autism that's not in our services based on severity level. I recently attended the Michigan Autism Conference earlier this year, and there's a lot of push for ABA in schools for all students, not just people with autism. I don't know what that looks like. That's outside of West Michigan CMH's world, but I think the education system is really trying to push towards that with some education, training, and different implementation.
And I know we've talked about ABA in the past, but break down ABA just for a moment for our listeners one more time.
Yeah, so I have some notes because it's really complex. Applied behavior analysis is ABA. Some of the goals could be to increase language and communication, learn new social skills, decrease problem behaviors. But what will happen in our ABA services is a BCBA will do a behavior assessment and determine what the treatment looks like, or trials, for example, with that youth. And we have technicians who implement those trials for X amount of hours a day. So some youth might get 15 hours a week, some might get 5, and it's all based on their treatment plan. It's provided in schools, it's provided in home, it's provided at autism centers that we have. So it's really just youth-centered and specialized to each person individually.
Is there a moment when you personally or your team, maybe there's a story, again, we don't want to cross HIPAA lines, but there has to be some moment that you were like, this happened. You know what I mean? Like you had somebody or have somebody with autism and they achieved this or this goal was met. Do you mind sharing that with us this morning?
Yes. So some come to mind because in our daily huddles, our youth teams bring up positives or client successes. And oftentimes there are ABA successes. And I'll give an example of one recently that I heard was a kid stuck their tongue out when asked.
Yeah,
That sounds very odd and very basic, but this youth, that was huge for them. Or they said mom, which they had no verbal communication skills at all, and they said a word.
Yeah.
So those things are really huge wins and are really exciting to see.
That's pretty cool.
Yeah.
And if you're just joining us, we're talking about with West Michigan CMH, Keeli Sholtey in the studio with us, talking about Autism Awareness Month. So before we transition here in a few moments to April is also Child Abuse Prevention Month, let's talk about, from your perspective, what we can do as a community to support the kids that have autism, the parents, adults that live with autism, because I would assume that most everybody knows somebody, even if they don't know that they're diagnosed with autism, they probably understand some characteristics of it. Sure. So what can we do in this month of awareness to increase our awareness, if you don't mind?
Yeah, I think it's really just that key concept of accepting differences. So everybody's different, and a big piece of autism services is learning functions of behaviors. So we all, whether we have autism or not, do things for a reason. And so it's maybe just having that open mind and understanding that someone's behavior, although might seem different to you or maybe even problematic or really robust, it might have a reason and a function of that behavior.
Yeah, understandable. Yeah. All right, this is good. Anything that we forgot to talk about when it comes to autism? And obviously we could fill hours with this subject. But the resources are available at West Michigan CMH. The crisis line is available 24 hours a day to reach out to. But anything else that we forgot to talk about?
I think this brings to mind, if you have a passion for this work, there are certifications you can get to be, you can actually become a tech without a degree. I mean, we hired, our contract agencies hires techs to implement these programs at our autism centers. So that's always an option, like high school diploma, right? And you can work with children with autism, which is awesome. And there's also behavior, BCBA certifications, which people can get. And I would highly recommend, if that's a passion you have, find that path. I mean, we can always use that. And I think the field really could benefit from more of people in that.
Absolutely. And there's a lot of people with big hearts to be able to help with that. Do you see, as an adult yourself, do you see that there are some adults that are diagnosed with autism later in life, and that can be super challenging for them, or have they just lived with this? I guess what I'm trying to say is, do you develop, do you worsen over time, I guess is the question I'd ask you.
I would say typically your symptoms are what your symptoms are.
Okay.
I don't know that the prognosis is it's lifelong. Okay. But I would say being diagnosed as an adult might be an experience that's freeing, like it explains my whole life.
Yeah, absolutely.
So I've seen that happen.
Okay.
But also, I really try to encourage people to not just be their diagnoses. You can have autism, but you're still you, and you're still your person. And I think that's empowering, too.
Very good. Very good information. Yeah. Let's shift gears for a moment for our listeners and our viewers out there. With tomorrow, we talked about the pinwheel. We talked about wearing blue as awareness for Child Abuse Prevention Month. What does West Michigan CMH bring to the table when it comes to services, when it comes to the options available for this? It's a very difficult conversation. Obviously, whenever we hear this happen, it's dramatic, and not only for those individuals within that circle, within what's happening there, but also those people that are, I never knew that was happening. I couldn't expect them to do that and stuff like that. I would assume there's services for a lot of that, a lot of those individuals affected, right?
Yeah, so we're a treatment provider. So oftentimes when we have youth in our services, maybe some things have already happened to them. So the goal of Child Abuse Prevention Month with the Children's Trust is prevention, right? So let's educate people. Let's provide prevention resources. The MI Parenting resource is awesome. That's the MDHHS resource. It's MI, I believe I put the website on there, miparentingresource.org.
Okay.
And that has hundreds of videos and engaging things that parents can do just from home that helps with like parenting skills. And you don't have to be a client to do that. Anybody in the world can do that. Okay. So I think it's really just providing resources like that and helping and just awareness of, I don't think people do things to do them. I think it's sometimes education. It's sometimes just lack of resources, or when your basic needs aren't met, sometimes it's hard to get to those other steps of life. So
on a serious note as well, as all this is do we have the support from the law enforcement, from the court system and such, in your opinion? Because you do interact with those agencies. Do we have the support to get those kids out of those situations, or be able to somehow remedy it in some way?
Yeah, I absolutely believe our relationship with the police department, CPS, DHS is wonderful. We can call them. We have most of their phone numbers directly. Hey, we have this issue. Hey, we have this going on. I mean, there is a centralized intake system for any of the reporting, but locally we do, coordinate really well with them.
Okay. There's something called Youth Mental Health First Aid. Bring us into that. What happens in that process?
Yeah, so that is a national curriculum. We have adult and youth mental health first aid, and we're offering that internally right now to all of our staff, and we have trainers that we've trained that are training our staff.
Okay.
And then eventually, I believe the timeline is this summer, we're going to be offering that to the community.
Okay.
So our 2 trainers will be doing law enforcement training, school training, and hopefully in the future, I envision it being community-based training.
All right. Very, very important there.
Yeah.
There are resources that you mentioned. My Strength app, we've talked about that quite a bit. Remind our listeners and our viewers about My Strength, if you don't mind.
Yep, you can access that through wmcmhs.org, and there's a little tab for My Strength, and that's a free service. Again, it's an app that helps with different coping skills, different tracking services for new behaviors or things you're trying to do to improve your life. But again, it's a free resource to anybody in the community.
All right. Lots of opportunity there. I asked the question again. We talked about Autism Awareness Month. We talked about Child Abuse Prevention Month, encouraging those out there tomorrow to wear blue on April 5th. You'll see the pinwheels there. Anything that you want to make sure that the community understands in any of those 2 topics before we wrap up today, and anything that just kind of brings it home a little bit, if you don't mind.
Yeah, so we talked about a lot of information today, so it could be a little overwhelming for people. I would just encourage people to call our agency, walk in, just have a screening done if needed, or just even talk to somebody about referrals to other places if needed. We're always here 24 hours, 365.
All right, very good. And it is true. Somebody's going to be there to answer the phone and be able to help, or at least to start that ball rolling, to connect with the different agencies. And you brought up a very good point, which is it's not just a singular agency. West Michigan CMH is proud to be able to work with other agencies that provide other services, right?
Yes, absolutely. Yep.
All right. Well, we appreciate you being here this morning. Thanks for joining us.
Thanks, Chris.
Absolutely. It is 8:48 now on 102.7 WMOM and Hot Country Hits.